Hello everyone, myself Kajal, clinical instructor from nursing department. So today we are discussing about skull, that is fetal skull. Here is the comparison between fetal skull and adult skull. Comparison of baby's portion to those of an adult. Here we can see the baby or fetal skull and adult skull. The baby's head is wider than the shoulders and 1/4 of the total length. Then what is fetal skull? The skull bone encase and protect the brain. The fetal skull has three major parts, that is vault of cranium, that is roof, face and base. Here we can see these three parts: face, then base, then vault. What Let's discuss about these in brief. First, vault in the large dome-shaped part above an imaginary line drawn between the orbital ridges and the nape of the neck. Then base. The base comprises bones that are firmly united to protect the vital centers in the medulla oblongata. Then face. It is composed of 14 small bones that are also firmly united and non-compressible. Here the bones of the vault, that is two frontal bone, two parietal bone, one occipital bone and two temporal bones. Here is the side view and the top view of the fetal skull. First, two frontal bone form the forehead, or that is also known as sinciput. The ossification center of each bone is the frontal eminence. The frontal bone fused into a single bone by age 8 years of age. Then two parietal bones which lie on either side of the skull and occupy most of the skull. The classification center of each of these bones is called parietal eminence. Next, occipital bone, which form the back of the skull and the part of its base. Part of it contribute to the base of the skull as it contains the foramen magnum, that is which protect the spinal cord as it leaves the skull. The ossification center is the occipital protuberance. Next, two temporal bones on both sides of the head. Temporal bones are present. It forms part of the vault and not significant in obstetrics. Here we can see normal skull of the newborn. Frontal bone, anterior frontal. Firstly, we will discuss about bone. Frontal bone, then occipital bone, then parietal bone. And let's discuss about frontal. First one is anterior frontal. Here we can see sagittal. Posterior anterior frontal, then posterior frontal. Then we will discuss about sagittal sutures, that is first one is sagittal suture. Here we can see frontal suture, coronal suture, and last one is parietal suture and lambdoidal suture. Let's discuss in brief sutures. Sutures are the space between the bones of the skulls. Two or more sutures meet is also called frontal. These sutures and frontal allow for molding of the fetal head during the labor. View from top of the head, that is coronal suture, frontal suture, sagittal suture, and last one is lambdoidal suture. And where frontal is, that is anterior fontanelles and posterior fontanelles. Thank you.